For the first time ever, uniformed military service members have access to a health care benefit that's long been available to civilian federal employees. That would be a health care flexible spending account. The enrollment period is nearly over, but it will come around again in the 2025 open season and for special circumstances between now and then. And joining me with the details, the Assistant Director for Military Compensation Policy, Ronald Garner. Mr. Garner, good to have you with us.
Hey, thanks, Tom. I really appreciate the opportunity to talk to you and your listeners about healthcare flexible spending accounts. You know, I am a retired service member myself, and I think about how beneficial this program would have been to my family while we were on active duty.
I should have known this. This is the first year they've had this available.
For uniformed service members, this is the first year that healthcare flexible spending accounts are available. We implemented dependent care flexible spending accounts last year, and this year is the first year for healthcare flexible spending accounts. So it's an unusual year in that the enrollment period for this year is from March 3rd to March 31st, which means, of course, we're right in the middle of the enrollment period right now. But the standard enrollment period for service members will be the normal federal benefits open season from mid-November to mid-December each year. And that will start in mid-November of 2025, so mid-November of this year for the next plan year.
So if they missed this one that's about to close on us, they can do it later in this year. And if something comes up in their life that they could use this money, there's an option for some other type of sign-up mechanism?
Yeah, there absolutely is, Tom. There are, like many programs of this nature, there are options to sign up based upon qualifying life events, right? And qualifying life events with respect to HCFSAs, you might think of things that constitute significant changes to your employment. So for a service member, that might be a PCS, right, or something of that nature, or a deployment. Say you're a single service member and you deploy, and it becomes obvious to you that you're not going to be able to utilize a lot of the funds that you would be putting into an HCFSA. That would be a qualifying life event that would allow you to stop sending funds to your HCFSA.
And I guess was under the impression that if you are in uniform as a service member, pretty much all of your health care requirements are taken care of by virtue of you being in uniform. But that's apparently not the case.
That's a good point there, Tom. So there are a lot of things that no health insurance system or no healthcare system is going to cover, particularly if you're talking about not just service members, but their families, right? So if you're a service member in uniform, certainly the coverage for you is very comprehensive under TRICARE. And for families, it is much more comprehensive under TRICARE than the vast majority of health insurance programs. But there are always going to be expenses that aren't covered by health insurance or that are just unexpected expenses that you incur in the spur of the moment, right? So, for instance, if you have a kid and your kid gets sick one day in the middle of the day, in the middle of the night, you're probably not going to wait until you can get into a healthcare facility to take your child in if they've got a cold or something like that. You're gonna go buy some cold medicine at the local pharmacy, and those kind of over-the-counter medications would be covered under an HCFSA.
If that child, say something near and dear to my heart, would need, say, glasses.
And that's an important point, right? It's not just traditional healthcare costs that are covered under HCFSA, but there are also vision care and dental care costs that are considered eligible expenses under HCFSAs. One that was near and dear to my heart when I was an active duty member was the cost of braces for my daughter. TRICARE Dental doesn't cover the entire cost of that. And as any parent who has had a teenager knows, those costs can be pretty significant.
Yeah, I've put a few on in my own life on kids over the years. We're speaking with Ron Garner. He's the Assistant Director for Military Compensation Policy at the Defense Department. And just give us some of the details here. How large can the accounts be, and what does it take to withdraw? What are some of the mechanics here?
Sure. I would like to just first start off by saying what an HCFSA is. And an HCFSA is it's a benefit, it's an optional benefit that allows service members to set aside pre-tax earnings to pay for eligible health care, dental care, and vision care expenses. Obviously, the one of the primary benefits of this program is that you can pay for those expenses while reducing your taxable income. right? So I think that this is going to be of great service to military families, particularly military families that potentially fall within that exceptional family member program community. Now, as to how much you can set aside each year, each member is eligible to set aside between $100 and $3,300 in a year. If you have two eligible family members, so if you and your spouse are both eligible, you can, through your employer, and it's not just military service members who have access to HCFSAs. Federal civilians have access to them. Many private sector employees have access to them as well. So if you and your spouse are both eligible and you maintain separate accounts, you can set aside up to $6,600 in a year.
All right. And then this is just in an account, and do you have a card that goes with it? Some kind of a debit card, or how does it work?
No, you don't. There's no debit card. So the way that it works is that the service member signs up for the HCFSA through FSAFeds.gov. They indicate how much they want to set aside in the plan year up to the $3,300 limit. And then they go out and they incur expenses the way that they normally would, right? So if you're, to use our example from earlier, you're going to get braces for your child. You would go out and incur that expense, you would pay for it, and then you would take your receipt or your statement of services or whatever you get from the provider, you would upload that to FSA Feds, and FSA Feds would reimburse you for all of those eligible expenses from the money that you have contributed. Now, there's an important point here, I think, to make, which is that when you contribute, you're going to contribute a certain amount each month. Let's say that you elect to contribute the full $3,300 in a year, and you're going to do that in $330 increments across 10 months. So even though you haven't contributed that entire amount at any point in the year until the end of the year, the entire amount of that $3,300 is available to you immediately after you enroll, right? So if you incur $3,300 worth of expenses a week after you enroll and you haven't contributed, more than, let's say, $330, you're still going to be able to get reimbursed for that full $3,300, and it will just continue to be withdrawn from your pay each month.
And I have a bigger question on this. We've talked about benefits for, say, children of service members. That seems to be the model that this is patterned for. That is to say, there's very little that the service member, him or herself, would need this account for, given the comprehensive coverage of TRICARE. This seems to be a family-oriented or partner, spouse-oriented program to begin with. Am I correct in that?
I think it is appropriate to say that the members who are most likely to benefit from this are members with families, that military families are more likely to benefit from it than service members who don't have families. Now, that isn't to say that there aren't benefits to this program to service members. There are certain things that you just can't cover with a health insurance program, even one as comprehensive as TRICARE. The best example of that is unexpected expenses. Anything that a service member can plan for themselves individually, they're likely going to, many things that they can plan for, they're likely going to be able to get taken care of through a military treatment facility. But there are a lot of unexpected costs that they're not going to be able to get taken care of through a military treatment facility. And so there are some benefits certainly to single service members. I think the greatest benefits are going to be to those service members with families.
Are you encouraging single service members to take an account anyhow?
What I'm encouraging any service member, whether they are a single service member or a service member with a family, a service member with an exceptional family member, any service member, what I'm encouraging them to do is to take a look at the benefits available through a healthcare flexible spending account. And there's plenty of information out there about it. They can do it. They can find information via FSAFeds.gov. We've put out a ton of information on the DoD Financial Readiness website. There's an FSA page on the DoD Financial Readiness website, and there's just a wealth of information out there. I'm encouraging them to get all of the information they can and make a determination about whether an HCFSA is the right answer for themselves and or their family.
Somewhere there's a list of things that TRICARE doesn't cover, and then there's also a list of things that the health spending account does cover, and that's